Did you know that some of the everyday medications you take might be linked to memory issues down the line? It's a scary thought, but many people don't even realize the potential risks. Today we're diving into cognitive health and dementia. Dementia is rising globally, affecting millions. Families face challenges and numbers are climbing. Awareness and proactive strategies are crucial. Open discussions help manage fear and uncertainty. Dementia is a range of neurological disorders. It affects memory, thinking, and behavior. Alzheimer's is the most well-known form. Age and genetics are significant risk factors. Lifestyle factors like diet and exercise matter. But what about common medications? Some medications may impact cognitive function. They might mimic or worsen cognitive decline. This is about empowering you with knowledge. Understand these links to make informed decisions. Many are unaware of potential side effects. We'll discuss 10 medication classes linked to cognitive decline. Don't stop your medications without consulting your doctor. That could be dangerous. Raise awareness and have proactive conversations. Know what to look for and ask questions. Let's explore these medications. First up on our list are antihistamines. These common medications help with allergies and cold symptoms. However, older antihistamines have anticholinergic properties, affecting brain function and memory. This can be particularly concerning for older adults, as it may mimic dementia symptoms. If you notice cognitive changes, consult a healthcare professional to explore safer alternatives. Older antihistamines can cross the blood-brain barrier, causing cognitive side effects like drowsiness and memory impairment. Newer antihistamines like Claritin and Zyrtec are less likely to cause these issues. They are generally safer for cognitive health. Discuss options with your doctor or pharmacist. Consider newer antihistamines for better cognitive health. Next on our list, we're going to discuss antidepressants. These medications are incredibly important and have revolutionized the treatment of depression, anxiety disorders, and a range of other mental health conditions. For millions of people, antidepressants provide essential relief from debilitating symptoms, improve quality of life, and can be genuinely life-saving. So, it's crucial to start by acknowledging their immense therapeutic value. Our discussion today is not about discouraging their use when clinically indicated, but rather about understanding the nuances of different types and their potential side effects, including those related to cognitive function, so that treatment can be optimized. Similar to the first-generation antihistamines we just talked about, certain types of antidepressants also possess significant anticholinergic properties. This is particularly true for an older class of antidepressants known as tricyclic antidepressants, or TCAs. Examples include amitriptyline, nortriptyline, imipramine, and clomipramine. While still effective for some forms of depression and other conditions like chronic pain or migraine prevention, their strong anticholinergic activity means they can interfere with acetylcholine in the brain. This mechanism, as we've learned, is directly linked to potential cognitive side effects, which can be a concern for individuals taking these medications, especially long-term. These anticholinergic effects from TCAs can manifest in various ways that impact cognitive function. Patients might experience memory problems, such as difficulty recalling recent events or learning new information. They might also report issues with concentration, feeling mentally foggy, or experiencing a general sense of confusion. For someone already battling the cognitive symptoms that can accompany depression itself, like slowed thinking or difficulty focusing, these medication side effects can further complicate their experience and make it harder to assess treatment efficacy. It's a delicate balance, and being aware of these potential effects is key for both patients and clinicians. It's very important to emphasize, however, that not all antidepressants carry the same risk of anticholinergic side effects or cognitive impairment. Newer classes of antidepressants, such as selective serotonin reuptake inhibitors, SSRIs, which include well-known drugs like fluoxetine, Prozac, sertraline, Zoloft, and escitalopram, Lexapro, and serotonin norepinephrine reuptake inhibitors, SNRIs, like venlafaxine, Effexor, and duloxetine, Cymbalta, generally have much lower or even negligible anticholinergic activity. This means they are far less likely to cause these specific memory and concentration problems, making them a preferred choice in many cases, especially for older adults or those with cognitive vulnerabilities. Depression and antidepressants can impact cognitive function. Treating depression is crucial for cognitive health. Symptoms like poor memory and slowed thinking are common. Medication selection and individualized treatment are key. Start low. Go slow with antidepressants. Report new or worsening cognitive symptoms promptly. Never stop or change medication without consulting your doctor. Discuss treatment options with your healthcare provider. Let's discuss anti-anxiety medications, or anxiolytics. These drugs manage anxiety symptoms by targeting neurotransmitters in the brain. Common benzodiazepines include diazepam, lorazepam, and alprazolam. They enhance GABA, the brain's natural calming agent. Effective for short-term relief, but long-term use has risks like dependence and cognitive side effects. Research suggests a potential link between long-term benzodiazepine use and increased dementia risk. This doesn't mean everyone will develop dementia, but the findings are significant. Chronic use may impact brain plasticity and cognitive function. Experts advise using the lowest effective dose for the shortest duration. Consider non-pharmacological treatments for long-term anxiety management. Discuss risks and benefits with your doctor. Stay informed to make proactive treatment decisions. Next up on our list are sleeping pills, also known by the more formal term hypnotics. These medications help individuals who struggle with insomnia, a common sleep disorder. They aim to induce or maintain sleep, alleviating daytime fatigue and impaired concentration. There are several classes of sleeping pills, including benzodiazepines and non-benzodiazepine hypnotics. Z-drugs like Ambien, Sonata, and Lunesta interact with the GABA system in the brain. They promote the calming effect of GABA, making it easier to transition into sleep. While effective short-term, long-term use raises concerns about cognitive functions and sleep quality. Let's explore how sleeping medications affect cognitive function over time. Next-day drowsiness and impaired coordination are common side effects. These can impact concentration, decision-making, and memory. Chronic use may lead to cognitive decline and dementia. Behavioral therapies like CBTI are recommended for chronic insomnia. Moving on to our fifth category, we have antipsychotic medications. These are powerful drugs primarily developed and prescribed to manage symptoms of psychosis, which can occur in conditions such as schizophrenia, schizoaffective disorder, and certain forms of bipolar disorder. Psychosis involves a disconnection from reality and can include symptoms like hallucinations, seeing or hearing things that aren't there, and delusions, fixed false beliefs. Antipsychotics work by affecting neurotransmitter systems in the brain, most notably dopamine, to help reduce these distressing and often debilitating symptoms, allowing individuals to think more clearly and engage more effectively with the world around them. There are generally two main classes of antipsychotic medications: first-generation antipsychotics, also known as typical antipsychotics, and second-generation antipsychotics, or atypical antipsychotics. First-generation antipsychotics, like haloperidol and chlorpromazine, were developed earlier and are often associated with a higher risk of certain movement-related side effects. Second-generation antipsychotics, such as risperidone, olanzapine, quetiapine, and aripiprazole, were developed later and generally have a different side effect profile, often with fewer movement disorders but potentially more metabolic side effects like weight gain and diabetes. Both classes, however, can have significant impacts on brain function, including cognition. While these medications are a cornerstone in treating severe psychiatric disorders, their use has expanded over time, sometimes off-label, to manage behavioral and psychological symptoms of dementia, such as agitation, aggression, or delusions in elderly patients with Alzheimer's disease or other forms of dementia. This off-label use is particularly relevant to our discussion today because it involves administering these potent medications to a population already vulnerable to cognitive decline. The decision to use antipsychotics in this context is complex and often comes after other non-pharmacological interventions have failed, balancing the need to manage distressing behaviors with the potential risks involved. It's critical to understand that antipsychotics are not a cure for the underlying conditions they treat, but rather, they help manage the symptoms. For individuals with schizophrenia or bipolar disorder, they can be life-altering, enabling them to live more stable and functional lives. However, the decision to start and continue these medications always involves a careful weighing of benefits versus risks by the prescribing physician in consultation with the patient and often their family. This risk-benefit analysis becomes even more nuanced when considering long-term use and the potential for cumulative side effects, especially those impacting cognitive abilities and memory, which we will explore next. Now, let's focus on the potential risks associated with the long-term use of antipsychotic medications, particularly concerning cognitive function and memory. While these drugs can be essential for managing acute psychotic symptoms, prolonged exposure can lead to a range of side effects, some of which directly or indirectly impact cognition. For example, some antipsychotics have strong anticholinergic properties, similar to some antihistamines we discussed earlier. Anticholinergic effects are well known to impair memory and learning, and chronic exposure can contribute to cognitive decline, especially in older adults who are more sensitive to these effects. Beyond anticholinergic effects, the primary mechanism of many antipsychotics involves blocking dopamine D2 receptors. While this is key to their therapeutic effect in psychosis, dopamine also plays a crucial role in motivation, reward, learning, and executive functions. Long-term modulation of the dopamine system could, in some individuals, lead to a blunting of cognitive sharpness, reduced mental flexibility, or difficulties with attention and concentration. This is not universally true for everyone taking these medications, and the effects can vary greatly depending on the specific drug, dosage, individual patient factors, and the underlying condition being treated, but it is a recognized potential concern. Specifically concerning older adults with dementia who are prescribed antipsychotics off-label for behavioral symptoms, the risks are even more pronounced. Regulatory agencies like the FDA have issued black box warnings for atypical antipsychotics, highlighting an increased risk of mortality, often due to cardiovascular events or infections like pneumonia, when used in this population. Furthermore, studies have suggested that antipsychotic use in dementia patients can actually be associated with a faster rate of cognitive decline and worsening of dementia symptoms over time, rather than an improvement in overall cognitive status, even if some behaviors are temporarily managed. Therefore, current guidelines strongly recommend that antipsychotics be used sparingly and for the shortest possible duration in patients with dementia, and only when non-pharmacological approaches have been exhausted and the symptoms are causing significant distress or risk of harm. Regular attempts should be made to taper and discontinue these medications. For individuals on long-term antipsychotic therapy, for conditions like schizophrenia, ongoing monitoring of cognitive function is important, and strategies to mitigate cognitive side effects, including choosing agents with a more favorable cognitive profile where possible, should be part of the comprehensive management plan discussed with their healthcare team. Muscle relaxants like cyclobenzaprine, carisoprodol, and baclofen help with muscle spasms and back pain. They ease tension, allowing muscles to relax, but can cause drowsiness and sedation. These effects can impair concentration and memory, leading to brain fog. Discuss any new cognitive symptoms with your doctor. Muscle relaxants can impact cognition, not just through sedation, but also via anticholinergic effects. Cyclobenzaprine, for example, blocks acetylcholine, affecting memory and learning. Reduced acetylcholine can lead to memory issues and confusion. This combination can significantly impact learning and memory. Especially in older adults, there's a higher risk of falls and confusion. Muscle relaxants are best for short-term use due to these risks. Discuss long-term use with your doctor and consider non-drug alternatives. Options include physical therapy, stretching, and heat or cold therapy. Medications for overactive bladder, like oxybutynin, relax the bladder muscle, but can cross the blood-brain barrier, blocking acetylcholine in the brain. This can lead to cognitive side effects such as confusion, memory impairment, and drowsiness. The cumulative anticholinergic burden from multiple medications increases these risks. Research shows a link between anticholinergic OAB medications and cognitive impairment, especially in older adults. Medical guidelines recommend caution when prescribing these medications to those at risk for cognitive decline. Discuss all treatment options with your doctor, including behavioral therapies and newer OAB drugs. Report any new or worsening cognitive symptoms to your physician promptly. Let's talk about opioid medications. Opioids like morphine, oxycodone, and fentanyl are powerful painkillers for severe pain. They provide significant relief but come with side effects. Opioids can cause sedation, drowsiness, and cognitive issues. They affect memory, concentration, and decision-making. Opioids bind to brain receptors, blocking pain but impacting cognition. While opioids are a major focus, other pain relievers like NSAIDs and anticonvulsants can also affect memory and cognition. Gabapentin and pregabalin, used for nerve pain, can cause drowsiness, dizziness, and memory issues. Chronic pain itself can impair cognitive function, making it hard to separate medication effects from pain effects. Effective pain management requires balancing relief with cognitive health, often using a multimodal approach. This includes physical therapy, acupuncture, mindfulness, and lifestyle changes to minimize medication reliance. Always discuss with your healthcare provider to find the best balance for your pain and cognitive health. All right, everyone. Let's dive into our 9th category: anticonvulsant medications. These drugs manage seizures in epilepsy and treat neuropathic pain, bipolar disorder, and migraines. They modulate brain activity, calming hyperexcitable neurons to prevent seizures. However, they can cause cognitive side effects like memory issues and brain fog. Effects vary by drug, dosage, and individual factors. It's absolutely vital to emphasize that anticonvulsant medications are often indispensable for managing serious, sometimes life-threatening conditions. For individuals with epilepsy, these drugs can mean the difference between a life constrained by unpredictable seizures and a life with greater freedom and safety. The message here is not to fear these medications or consider stopping them without extensive medical consultation. The benefits they provide in controlling seizures or managing chronic pain frequently far outweigh the potential cognitive side effects for many patients. Our goal is to empower you with knowledge so you can have more informed discussions with your healthcare team. The experience of side effects, including memory issues, is highly individual. Some people may take anticonvulsants for years with minimal to no noticeable cognitive impact, while others might experience these effects more acutely, even at lower doses. Factors such as age, baseline cognitive function, the specific type of anticonvulsant, and the presence of other medical conditions can all play a role in how an individual responds. This variability underscores why personalized medicine and close monitoring by a physician are so important when these medications are prescribed. It's not a one-size-fits-all situation, and treatment plans should be tailored to each patient's unique circumstances and needs. If you or a loved one are taking an anticonvulsant and notice new or worsening memory problems, concentration difficulties, or general mental fogginess, it's crucial to bring this to your doctor's attention. Don't just assume it's an inevitable part of treatment or aging. Your physician can help determine if the symptoms are indeed related to the medication. Explore potential strategies like adjusting the dosage, switching to a different anticonvulsant that might have a more favorable cognitive profile for you, or even investigating other contributing factors. Open communication is absolutely key to optimizing your treatment and maintaining your quality of life. Ultimately, the decision to use an anticonvulsant involves a careful weighing of benefits versus potential risks, a discussion that should always happen between you and your healthcare provider. For many, the control of seizures or severe pain is paramount, and some cognitive side effects might be a manageable trade-off. However, being aware of these potential effects allows for proactive monitoring and management. The goal is always to achieve the best possible therapeutic outcome with the fewest and most tolerable side effects, ensuring that treatment supports overall well-being, including cognitive health, as much as possible. Blood pressure medications, or antihypertensives, are crucial for managing hypertension, a major risk factor for heart disease and stroke. Millions rely on these drugs to protect their health. They work by lowering blood pressure through various mechanisms. Controlling high blood pressure is essential for brain health. However, aggressive lowering can affect brain perfusion. Symptoms like dizziness or fatigue may occur initially. These are usually temporary as the body adjusts. I cannot stress this enough. Managing high blood pressure is absolutely crucial for protecting your long-term brain health. Uncontrolled hypertension is a leading risk factor for cognitive decline, vascular dementia, and both ischemic and hemorrhagic strokes, all of which can have devastating consequences for memory and overall brain function. Therefore, blood pressure medications play a vital, protective role. The potential for minor, often temporary cognitive side effects in some individuals pales in comparison to the significant brain damage that uncontrolled high blood pressure can cause. These medications are truly lifesavers and brain savers for many. While most classes of blood pressure medications are not strongly associated with significant, persistent memory impairment, some older types of beta blockers, particularly those that are more lipophilic and can cross the blood-brain barrier more easily, have been anecdotally linked to fatigue or mild cognitive complaints in some patients. Similarly, some centrally acting agents, which work directly on the brain to lower blood pressure, might have a higher potential for CNS side effects like drowsiness or mental slowing. However, newer generations of antihypertensives are generally very well tolerated with minimal cognitive impact for the vast majority of users. If you are taking blood pressure medication and experience new or concerning cognitive symptoms, especially if they appear shortly after starting the medication or after a dosage change, it's essential to discuss this with your doctor. They can assess your blood pressure readings, review your medication regimen, and determine if any adjustments are needed. Sometimes, symptoms like dizziness upon standing can be managed with simple lifestyle advice, or it might indicate that the dose needs fine-tuning. Never stop or change your blood pressure medication on your own, as this can lead to dangerous rebound hypertension. The goal of hypertension management is to achieve optimal blood pressure control to protect your heart, brain, kidneys, and other organs, while minimizing any undesirable side effects. This often requires a collaborative approach between you and your healthcare provider, involving regular monitoring and open communication. For the overwhelming majority of people, blood pressure medications are safe, effective, and vital for maintaining not just cardiovascular health, but also promoting long-term cognitive well-being by preventing the severe consequences of untreated hypertension. It's about finding that perfect balance for your individual health. We've discussed medications that might affect memory or cognitive functions. These drugs, from antihistamines to antidepressants, can have unintended cognitive effects. Always consult your doctor before making any changes. Thank you for joining Health Tribe. Like, comment, and subscribe for more health content. Stay happy and healthy.